Luciana Berger, 20 weeks to the election. You must be doing this a lot. What if there are two issues that are coming up time and time again on the doorstep? What are they?
I think the two biggest issues that I'm hearing on the doorstep, one of them is around the cost of living crisis, and that people are working incredibly hard and yet they feel they're going backwards, not forwards, that they've seen their wages stagnate, they've seen prices go up, and quite often people are on 0-hour contracts trying to juggle loads of different jobs. So it's people that are in work also that are really, really struggling to get by, and I hear that all the time. And I think one of the other big issues is around the National Health Service, and people really, really not very happy about the fact that 1 in 4 are struggling to get an appointment with their GP within a week. The fact that they've seen friends and family that have waited for an ambulance or in A&E, and people are very concerned about what the winter holds for our National Health Service.
You must have seen the CQC banding, which is not definitive. It's not like an inspection, but there's a lot of concerns about some of the deficiencies in a lot of doctors' surgeries, and that's a real worry, isn't it? Especially coming out, as you said, to the winter.
Well, and I work in the Shadow Health team, and we're looking at what we can be doing to improve our National Health Service. It's so important that people get access to really good quality primary care through their GP, and it also prevents people from turning up in an accident emergency. It relieves some of the pressure on our hospitals. So it's absolutely key that we invest in our GPs. That's why we want to add an extra £2.5 billion a year to our NHS, which will see an increase of 8,000 more GPs across the country, and that will also help alleviate some of the pressures.
Not only physical health, but mental health, and I believe you're over in South Wales and East Surrey with Mike Lassurf. There's a real concerns about mental health in this country, isn't there?
There is some concerns, and that's why we as the opposition campaigned to get parity of esteem for mental health. That means that we should be putting mental health on exactly the same footing and giving it the same attention that we do to physical health. That's why we're looking at what our NHS should be doing for the future, and why we want to bring together physical health alongside mental health and social care all together. I'm very concerned about some of the things I'm hearing from across the country. You mentioned Basildon, where I was earlier this week. We know from a report that came out from the Royal College of Nurses that there's been a reduction of 3,300 nurses that work in mental health, and there's too many stories of people that are having to travel hundreds of miles in order to access treatment. It's not good enough, and that's why we as Labour are working really, really hard to think about what we should be doing to ensure and actually make sure that we deliver parity of esteem for mental health.
Luciana, thank you.